everyone for coming today. I'm glad you can be here with us. I'm Sarah Fessler. I'm the president of the Rhode Island Medical Society, here today with representatives from several other organizations. And we are specifically here to ask Governor Raimondo to veto a bill, a law that would access confidential healthcare information without a search warrant. So specifically, this law allows law enforcement to access the Physician's Drug Monitoring Program, which is a program in this state which allows healthcare providers to see what medications, controlled medications, patients may be on. And the reason behind having this program is twofold, really. One is safety and patient care, to make sure that we're not prescribing medications that could interact with each other, be dangerous together, to know whether patients are taking medications from other healthcare providers in addition to ours that could be dangerous for their health. And the other reason is so that the prescribing of prescription drugs in Rhode Island can be monitored on a health department level to make sure that prescribing in Rhode Island is safe. So in other words, keeping an eye on whether some patients are shopping around for pills in case there could be cases of diversion, and also looking at prescribing patterns in the state to make sure that we don't have a problem with the other states have had with pill mills where folks are obtaining medications easily and then subverting them into the rest of the population. So we're here with the concerns that this bill, in addition to being both ineffective and unnecessary, undermines our efforts in trying to get this epidemic, opiate epidemic, under control. We feel that if the public is aware that law enforcement can access the PDMP without a warrant, they're less likely to seek medical help that they need. It's sort of like having the police officers in your medicine cabinet without a warrant to be there. And we feel that if anything, this could increase folks' movement toward more dangerous drugs, particularly heroin and fentanyl. And as a practicing physician, I've actually personally witnessed this happening to folks when they are finding it more difficult to find pills. They're moving toward more dangerous drugs. And actually, the majority of overdoses in Rhode Island, the far majority, are now from heroin and fentanyl and not from prescription drugs. So we feel that that judicial review and should be the standard by which police gain access to the Physician's Drug Monitoring Program, and we are opposed to this access being obtainable without a warrant.